Okay, to start with, I'm Andrew Thomas. I'm the group manager for what are now called Prevention and Wellbeing Services within Bridgend County Borough Council. There is a backstory. I think a couple of years back, my former Director of Social Services, Susan Cooper, had either the foresight or took a leap of faith to integrate probably an unusual range of services within social services and well-being. And I think my previous portfolio would have included things like leisure centres, swimming pools, libraries, community centres, and they have been seen as an opportunity, I suppose, to get better value for money out of public investment in those assets and become more person-centred in terms of delivering on well-being, particularly for the more vulnerable and people that would be deemed a priority for health and social care partners. I'm assuming that most people on the call will have had a chance to look at the web page that has been developed. I only signpost that because the digital stories, the imagery and some of the case studies will probably provide far more colour for what we've tried to do than I will be able to put forward within this presentation. But Super Ages is the project that we put forward, and Sue Cooper encouraged me to put forward for working with Bevan. Essentially, it's a regional approach. It's a 3-year programme that needed a very solid start if it wanted to contribute to health and well-being across Wales, and encompasses the whole of Cwm Taf Morgannwg as a new health board footprint. Very strong links in working with the third sector, the CBCs across the 3 areas, and with very clear outcomes, trying to work with older adults to improve physical and mental well-being, looking at how the right things could bring people together to help those people to maintain their independence in communities, but focusing on future generations, goals of sustainability, community ownership is quite a visible theme, I think, within that first slide. And beyond the ingredients of participants, leaders, working with mentors and the places, what were the great things to do that would improve well-being as opposed to any and everything that we could do. So in terms of things that this programme achieved, I think it started strongly. You know, it secured competitively £400,000 of healthy and active fund investment, which in my world sounds quite a sum. But when you spread that across a 3-year programme, across multiple partners and 3 local authorities, at a community level, at a person-centred level, probably not huge sums of money. The key thing that I think working with Bevan has opened up is the learning and insight and the understanding that our programme has gained has opened other doors in terms of working with Integrated Care Fund, leading on transformation investment and building resilient communities. And I think the philosophy that goes with them about innovate and scale up. So in terms of some of the icons that are there, our Olympic programme has basically been working with older adults to modify activities to meet needs. The thing I like on the first one, our Olympic programme, and you may have seen it in the case studies, whilst we have the numbers, it's been able to work in a range of settings. So we've managed to trial that in daycare, in care homes, with learning disability projects, but also within mainstream community projects and with older people or intergenerational groups. In terms of who might work in this kind of environment in the future, the obvious candidates for people working in sort of the leisure and physical activity sector would have been sport and recreation students, but we've tended to work with Bridgend College and health and social care students, people that might actually be physically present in settings where those skills may have value going forward. And similarly, a lot of our younger people that we're working with in schools have aspirations to work in these kinds of environments and to work with older people. Then I think we're all aware that at the end of March and leading up to March, the pandemic arrives, people became cautious, shielding arrived, and the original plans of the scheme had to be rethought. So quite a lot of work went on trying to understand how to support people at home. You can see the numbers there. It wasn't hard to support people at home that were digitally connected, but it emphasised the digital divide, I suppose, between different types of older people, skills, confidence, and resources. So beyond our digital approaches, we went back to creating DVDs, hard copy workbooks, and they tended to work with people. It just meant you had to work a little bit harder and talk to more people. And I think we also identified that some older adults needed more support than others. And you may have seen in our slides, the support at home program, the telephone essentially came back into its own, and regular conversations and motivational talks and discussions and being able to support a broad range of things came into their own also. Our Park Lives program is showing the exit in August, September of working with some of our people and trying to get them back outdoors and to co-produce what a safe opportunity looks like. Most of those people have stayed with us from that period and have started outdoors and are now back uh, working with activities indoors and have the confidence to do so. I just wanted to touch on some of the other doors that opened through integrated care funding and other things, and our ability to work with a broader range of partners. So working with Halo Leisure, our Feel Good for Life program, supporting people with dementia, carers and people with cognitive impairment. Started as dementia friendly swimming, has moved into a broad range of things. Secured the UK Active Award this year for innovation and physical activity, and it's also secured big lottery investment to start looking at how digital can enhance relationships between those partners. We've managed, working with our exercise professionals, to develop a mobile postural stability program trialled in sheltered accommodation to reduce falls, fears of falling, and as we say, postural stability. And very positive results, but we've got some resource to build on those and trial that in 2 more parts of the county borough. Carers becoming more and more important and probably able to get maximum value from the things that we run. Looking at how we can create networks of carers and cooperative models, working with Wales Co-op and Digital Communities Wales. For those of you that follow Facebook, our Stronger Together Bridgend digital social prescribing offer has grown, showing that people are quite balanced, whilst physical activity and well-being are fine. People like other things, so we have quite a lot of things that have carers discussions, dementia supportive activities, but also the creative and the cultural, and that's engaging perhaps more people than some of the physical activity options. And then finally, we've managed to secure some minor capital investments, make it easier to access our buildings, and once you're in them, to actually take part in a broader range of things. So the data I'm showing you on screen is a small sample of people. It's probably the 50 people that we've started to work with rebuilding coming out of lockdown and moving back into the new normal, as people call it. And there are some positives there. What I would say is this is going to be another challenge. Things that we had put some energy into building, people are cautious, people are less optimistic for the future is the feedback they're getting, but these types of activities and opportunities will be part of a solution that really helps build that. Works with local community coordination. We've done some analysis with Swansea University previously that had showed a social return of 4 to 1, but I would emphasize connecting people into the right support and the right activities that can improve well-being has been one of the key learning points here, as opposed to connecting to anything or everything. So we've developed what I suppose is quite an optimistic model that says your journey through life and the aging process isn't necessarily one of moving towards frailty and managed care. That, even today we can do things that can improve the well-being of people who are more housebound, less mobile, or people who are having those kinds of support, and we can de-escalate with the right people in the right roles at the right stages. But again, this focuses on having the right things that meet people's needs, and create engagement and I suppose a level of excitement. It's an asset-based communities model that doesn't start from the question we often ask is what are the problems we are trying to fix. It looks at what are the strengths within people and their hopes and aspirations for a good life that we can work with them to actually make some of that more of a reality. So in terms of the ingredients, if this was the bake-off, the obvious recipes there is people being aware of what is out there, so good information, people having the right support, and us recognising that different people have different skills, and building trust with a lot of the older people, I think, to actually be honest and open about what it is they seek in life has been part of the learning from this programme, and that you cannot make a giant leap from someone who is housebound or having higher levels of support to actually be straight out there into communities. So there's quite a lot of energy going into that process. But again, it's people having the right opportunities. We talk about signposting, but very often we've found you signposting to a gap or the wrong opportunities. So this almost says there's a need for community building, and many of the things that could really enhance the well-being of people may still yet to be created. So throughout transformation work, there's a focus on this community building and how do we create the opportunities and make them sustainable by working with the people that arguably are the beneficiaries of those things. So I guess the people we're trying to help can actually become part of a solution rather than consumers of services in a number of instances. So a couple of the different types of people that would fit in different parts of that pathway. Maria is a real person. She loved this icon. Um, the truth is, from being part of this program, she will have more options, ability to connect and support more people, but also the ability to get people together to build those new things that I've spoken about. If they are not there, but they are the things that people require. Sending people to a card club, making club is fine if that's what they want to do. Very often, many people want other things. So I think our local community coordination program has been strengthened. Jeff is a former health board employee. Jeff is retired. Jeff has had a hip operation, but Jeff now chairs our Older People's Forum and is fully qualified as an exercise professional and runs multiple classes per week for multiple beneficiaries. In its simplest forms, if I can get 12 people like Jeff, we've probably cracked one aspect of what we're trying to achieve. But in terms of these two people in the middle, Megan is one of our case studies. We suddenly found trying to support Megan at home. Megan had visual impairment, and so using the telephone became very much a first point of contact discussion. We supported her with other things, helped her to remain active, and I think one of the outcomes in Megan's story has been applying for a guide dog because she really wants to get back out and in the community. Rita was probably on the higher end of complexity for us, 2-day centre visits a week, 2 home care support visits per day. The day visits are gone, the home care aspects greatly reduced, and Rita will say that she's too busy in her community to actually need some of those other things. She has a friendship group and they help each other. So it's possible, I suppose, is what I'm saying. In terms of what Bevan has done for me, I think, it was described, Helen, at the start, I probably come at this from a different background to many of the people that have been through the program, but really loved it. If I'm being honest, it's built my confidence in working within this sphere. A couple of things I pick out from my evaluation. I managed to play a meaningful part in our adult social care inspection, with prevention becoming more and more a part of that process. The performance framework for prevention is developing. The bits that we're finding hard is what costs have you saved, because very often someone is backfilling what you've managed to reduce or remove somebody from. So we look at cost avoidance, we look at cost reductions and options where we can work in partnership, but ultimately there is this leap of faith that improving people's well-being is a starting point to improving broader health. I just wanted to touch that I'm part of a national advisory group with Sport Wales. Now we're from January of this year, a Welsh Government active leisure project for the over 60s based on behavioural change is about to begin. I can't claim it relates to this, but I will be able to apply some of the learning that I've gained from my journey with Bevan to it. So I'll leave you with a caption competition. I quite like this photo. I think she's saying, "Hold my bag, the wrestling's about to start." And if you've seen the if you've seen the digital stories, older adults love fun and they love competition, and we shouldn't forget that it's all part of rebuilding normal lives. So that's me. Thank you.